Maria and her husband Francis were 24 weeks into her first pregnancy. The young couple was filled with nerves and excitement about the baby to come. Infant clothes, toys, and even the baby's room, crib and all, were finally coming together. They had waited 7 years before they decided to conceive, and finally the time had come. Maria described the dreams she had for her child. She envisioned him taking his first breath, his first smile, and his first sound of laughter. Dreams of the beautiful change her life was about to take just within a few months. It was that 24th week on a Friday that Maria fell. Her minor slip sent her to the office of Dr. Brian Rigney later that evening. He opened the office and asked her several questions while checking basic vital signs of the child. Maria rested that weekend and was not only cautious, but scared. That Monday afternoon, Maria began to experience bleeding and once again took a visit to the doctor's office. Little did she know this would be the beginning of many visits filled with much uncertainty. Tuesday afternoon, after an eerily quiet ultrasound, Maria and her husband were sent to Yale for further testing due to an abnormal finding of the head of the baby. Maria was examined by the head of the obstetrics department at Yale. His explanation was confusing and full of uncertainty as to what was going on. He mentioned an abnormality in the shape of the baby's head and that the sutures were beginning to close. He said that it could be the normal formation of the baby's head or an underlying problem that could reveal itself further into the pregnancy. Time was of essence because Maria was ending her second trimester and entering into her third. In Connecticut, it is illegal for a woman to undergo an abortion in the third trimester. The choices that Maria faced were to either terminate the pregnancy or continue the pregnancy with regular ultrasounds. The doctor told Maria that further testing needed to be done and choices needed to be made. Mona Iannotti was Maria's genetic counselor who arranged for Maria to receive a second opinion from the head of pediatric radiology of Yale as well as John Dempsey Hospital of Yukon. Mona had her own idea as to the diagnosis of the baby. Both Yale and John Dempsey's findings matched what Mona believed to be true. Maria's child had craniosynostosis. Craniosynostosis is a premature closing of the skull's sutures. Maria was the first woman in the United States to have a child diagnosed with this disease 5.5 months into the pregnancy. If the baby did survive, he would need to undergo multiple surgeries after birth and into childhood in order to open the sutures in the skull to make room for proper brain development. Maria and her husband were scared. The early diagnosis made the prognosis even more serious. The couple did not want their child to suffer. They did not want him to be in pain and to undergo procedures for the remainder of his life that would affect his quality of life in such an incredulous way. Maria felt it would be an injustice to subject a child with this difficult diagnosis to only suffer in multiple ways for years to come into a world that was difficult enough. Maria and her husband, with the guidance of the genetic counselor and doctors, chose to terminate the pregnancy on February 2, 1992. Maria's husband, sister, and mother were by her side during the birth. She underwent much emotional and physical pain. Maria explained the following days to me. They did not return home for about a week. Her husband went back to their home and cleared out the baby's room and put away the crib and the toys that had been bought. The autopsy revealed that the child had facial features linked with Crouzon syndrome, a rare genetic disorder which causes shallow orbits and protruding eyeballs, underdeveloped cheekbones, and an incomplete formation of the roof of the mouth. In Maria's case, the genetic disorder was not inherited, but a new mutation, which meant that the risk of having another child with this disease was increased by 2% more. Through counseling, their priest, and most of all, their love for each other and the love from their family, Maria and Francis were able to move forward, accept the reality of the situation, and live with peace in their heart. Approximately 1 year later, Maria and Francis were pregnant with their second child, a baby girl. 3 years later, she gave birth to another baby girl. The family now resides in Hamden, Connecticut, and never ceases to remember that they will always be a family of 5.